The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And it must be Friday, and indeed it is Friday. We're coming at you live from the Scottsdale Air Park, Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is the first time you've tuned into our show, this show that we have been producing for you, our listeners, for the last 7.5 years, is a show about how our older adult population can live a healthier, happier life. And how do we do this? We do this by bringing extraordinary guests to the show, and today's no different. I have a guest that has been here in our studio 3 times prior. Her first appearance was back in January of 2017. She was back again July of 18, and then the last time she was here is May of 2019, and I am pleased to have her here now in July of 2020. So welcome back to the show, Senator Heather Carter. Welcome back, Heather.
Well, it is my pleasure to be here with you, Bob, and what a unique period of time we find ourselves in, and we're still doing radio.
We're still doing radio, and you know, the wonderful thing about having you as a guest here on the show is that you are an advocate of the work that we do at Cypress and home care and in health care in general. You are a senator in our state legislature. You are head of our Health and Human Service. What is it? The committee? Health and Human
I'm vice chair of the Health and Human Services Committee in the Senate, and I was chair of the House Health Committee for 6 years prior to that.
And just about a month ago, we had your chair. It was Senator Kate Brophy McGee here in the studio. So it's great having you here in the studio. Actually, you're not in the studio. You're coming at us through technology. I'm seeing you on my computer, but you're also coming in through the phone line, so we have a crystal clear line. So welcome to the show. Welcome back. And you are in the midst of an election year. We got a primary that's coming up on August 4th, and I can't say it loud enough. Please get out there and vote. Your ballots have been delivered to you. If you are doing a mail-in, make sure you mail those in. And I know that being it's COVID time, Senator Carter, you've been busy, but I would imagine being an election year, it's been even busier for you.
Yes, this is definitely a busy time for all of us. We're all managing our work schedules, our families, taking care of our loved ones. And obviously things are complicated by the COVID-19 situation. So if you don't mind, I'd like to talk just a little bit right now. You mentioned the election, just on how the election will finish over the next 2 weeks, because it's going to be different. And I'm out talking to voters every day on the phone through appropriate social distancing protocols, and they have a lot of questions. They have a lot of questions about is their ballot secure if you mail it back? And yes, it is. Some of our seniors have decided to drop it off directly at the post office, and that's obviously available to you. But this election cycle, Maricopa County Recorder's Office have opened up new facilities called voting centers. And we are approaching a period of time where most of the voting centers are open as of today, and then starting next week, pretty much all of them will be open up until Election Day, and then just 1 or 2 more will open. So if people are holding on to their ballots thinking they will return them on Election Day at their traditional polling site, that may not be the case, because many of the polling sites, for example, were schools or churches or community areas that are now closed during our COVID-19 situation. So it's very important for people to check online where they can drop their ballots off or where they can go vote in person. And you can do that at maricopa.vote, V-O-T-E, and you can visit the website, beballotready.vote, to make sure that everything is set up for you to participate in this election. This is an important primary election, and since we're in the middle of a public health care crisis, I want to make sure people have the information they need to cast their vote, because their vote matters.
Thank you. It's very important to know that, and I didn't know that you could handle the ballots in the way you did describe, because I used to be one of those people that used to drop it at the polling place and not even thinking the schools may not be open.
Right. So today is the last day. If any of your listeners would like to request a ballot to be mailed to them, today's the last day to do so by 5 p.m. So you can either call the county recorder's office at 602-506-1511. I'll give you that number again, 602-506-1511. Or you can go online to maricopa.vote, and there is a menu of options that you can select to get the answers you need to make sure you have the information to vote in this election. And the voting centers are open, most of them, Monday through Saturday. So if you are a Election Day voter and you typically go into your poll place, you can go into one of the voting centers any day of the week, Monday through Saturday. And you can go to any of the voting centers. So if, for example, like in my area, if you're up in Cave Creek, you can go to the Cave Creek Town Hall now and vote. Or if you're over sort of on the northwest side of town, you can go to the Arrowhead Mall. They have a facility. There's one at Bell Canyon Pavilion. There will be one opening up at PV Community College. So if you go online, you can find a list of all of the voting centers that are open, and you can go to any voting center anywhere in Maricopa County to vote.
Thank you. I wasn't intending for you to bring this up, but I mean, it is so important for our listeners to know this. Now, Heather, if you're going to mail in your ballot, when should you put it in the mail? Because the election is August 4th, and you certainly shouldn't do it August 3rd. But when's the last day you should be planning to mail your ballot?
July 29th. It's a hard stop. If you do not have your ballot in the mail by July 29th, you must take it to one of the voting centers. Otherwise, there's a good chance it won't be counted. In Arizona, we don't look at the postmark stamp. The county recorders close off all voting at 7 p.m. on August 4th. So your ballot must be in possession at the county recorder's office to be counted. And at that maricopa.vote website, this is another thing. My seniors that I've been talking to, very appreciative of this information. You can register to receive an alert that your ballot has been received and your ballot has been counted. That's what people are concerned about. They want to make sure that it didn't just get lost in the mail. So if you go to that maricopa.vote, you can sign up for a text message or an email. And, for example, I mailed my ballot probably about 2 weeks ago, and within 3 days I received a message that it was received, and hours later it was counted. And that gives security to the voter to know that their vote was received and counted appropriately.
I did not know that. That is so fascinating that we're able to do that in this day and age. You know, this was really important to get this to our listeners, and I know, having been on the show 3 times before, our time goes really fast, but we have so much to cover because we are in COVID times right now, and these are unique and different times. And you are, by the way, running in this primary, so you are running on fumes right now, and I imagine these next couple days are going to be rather busy for you. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and I'm really proud to have Senator Heather Carter here in the studio. We have an election year coming up, And we've got 3 more segments coming up, so stick around. We've got a lot to cover. We will be right back. Hi, my name is Bob Roth, and I am the host of Health Futures. We are live every Friday at noon and have been for the last 7 years. In addition, I am the managing partner for Cypress Home Care Solutions. We are a home care agency that has been supporting our community for the past 26 years. This pandemic has been extremely challenging for families, and certainly on the options on what they can do with their older adult loved ones. With the communal living space being so challenged through this pandemic, home care is a great option and is typically preferred 9 times out of 10 by our older adult population. So if you're wanting to keep your loved ones at home where they can be safe, please call us at Cypress Home Care Solutions. You can reach us at 602-264-8009 or look us up on the web at cypresshomecare.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, I've got Senator Heather Carter here. I wouldn't say in the studio, but I've got her coming in via technology through Google Meet, and she's on the phone lines. Welcome, Senator Carter. It's great to have you. And in our first segment, you really were great in talking about how to get out there and make sure you vote, because during COVID times are really, really different. And I don't want to rehash everything we talked about in that first segment, but I want to tell our listeners, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch this show and about 350 others that we've been bringing to you for the last 7.5 years. I do want to say, if you really want to learn more about it, you said, Senator Carter, go to maricopa.vote, and you can get places on where you can drop your ballots. And this is a very important election. And I do want to give you a shameless plug while you're here. If you want to donate to Senator Carter's campaign, how do we do this?
Well, you can visit my website at voteheathercarter.com. And on that homepage, there will be a menu button, and you just click on the button that says donate. Also on my homepage is a link to voter resources. So all of the information that we just discussed is on my website as well. So they can simply click on the link and have access to everything they need to be able to vote in this election.
VoteHeatherCarter.com. Fantastic. So you have now really completed a decade now being a public servant. You got into this back in 2010, if I recall. And prior to you coming as a public servant, you were a teacher and working in the school district, I think in the Cave Creek School District, right?
In the Paradise Valley School District.
Yes.
My daughter attended school in the Cave Creek Unified School District, and I also represent the Deer Valley Unified School District. So the 3 school districts for my legislative district are all unified, PV, Cave Creek, and Deer Valley. And
my children, my 3 daughters, all came up through the PV school district, and they went to Desert Shadows Middle School and Sonora and Sky Elementary, and they went to Horizon High School. So we're
Go Huskies!
Go Huskies!
My daughter just graduated last year. Yes.
Yes, great high school, and all 3 of my daughters, and I've talked about it here on the show, are out there working in the workforce, and thank goodness that they are. And I don't love the word essential workers, but they're working, and they have meaningful jobs, and they're making a difference in people's lives. And as you are as well. And you know, the thing that gravitated me to you literally like 10 years ago was the fact that you are very, very much in tune in what's going on in healthcare. And I talked about this in the first segment. You've been on 3 different times. One of the times you brought your mom on the show, and I know that
Yes.
you're dealing with healthcare challenges, and you certainly have shared with me some of the things that you have dealt with in terms of our older adult population, because you're living it right now, and so many people in our communities are trying to struggle in terms of how do I take care of my mom and dad, and how do I take care of my children, and you're living proof of that.
It is a complex world we live in right now, and trying to juggle, your own family, your work, and everything else that's going on can be overwhelming. And I can tell you, as the primary caregiver for my mom, our seniors are really suffering. They are afraid, obviously, of contracting COVID-19. They are concerned if they have any additional health problems. And then, because they are so vulnerable to this disease, they have to really be hyper-vigilant about staying home and making sure they're putting everything in place to keep themselves safe. So it's difficult when families can't come together like they typically do. Birthdays are completely different. Weddings, we've had weddings on Zoom. I had my aunt, she participated in a wedding back in, the wedding was in Pennsylvania. She was in Arizona. She did it on Zoom. I'm going to a drive-by baby shower tomorrow for my niece. My other niece delivered a baby during COVID, and only one, she was so fortunate that her husband was even allowed to be in the delivery room. There were times where husbands couldn't be with their wives delivering the baby. And then when they returned home, the family visited the baby through drive-by through windows. So our entire world is turned upside down right now. And we are working as hard as we can to keep our loved ones safe. And we just need to be mindful that it's taking a toll on them as well. I know many of our seniors, unfortunately, live isolated lives anyways, and this has just confounded that situation. And so we need to do everything we can to reach out to our seniors and stay connected. And modern technology, we had talked before the show, thank goodness this happened in 2020 and not in 1990, because we have the technology tools available to us. Obviously, there's a learning curve for our seniors. I could talk about this, and maybe we want to talk about this now or later in the show, but just the learning curve to get our seniors on board with telehealth services. So grateful for the technology. Just make sure you're reaching out to your seniors so that they can use it and stay connected.
I want to abolish a word that everyone uses, and they don't realize what that truly means. And you used it before, and I think it's because we are hearing it so much, and that's social distancing. I want to change that to physical distancing, because we need to figure out how to be more social with our older adult population. And you and I have talked about this before. Social isolation is absolutely destroying the elderly population. They don't get a chance to have contact with other humans, sometimes not more than once a month. And we crave that as human beings. And what has happened with COVID is we have now isolated our seniors even more. And I'll give you a prime example, and I've shared this with our listeners. My aunt, of 95 years old, she'll be 95 next month. She lived in Florida for over 30 years, and most of her friends had passed away, and she figured she'd get closer to where her family is, and that's up in Connecticut, living really close to her daughter, like 10 minutes away. So she moved to Hamden, Connecticut in February 2019. And here it is, fast forward, now we're in July of 2020, and it's been 4 months, and she sits in this long-term care facility. She's not adept to using technology. She's going to be 95, and she looks at 4 walls. She has a personal care aide or a CNA aide that comes in 3 times a week to help her with bathing and personal care, and her meals get dropped off at the door. How is this any different than being in jail? Really,
I know.
and she is typifying our older adult population. So I want to abolish that word. social distancing, it's physical distancing, but we also need to work on being more social with our older adults.
I agree with you 100%. The governor launched in his initial sort of campaigning around what are we going to do with the stay-at-home orders is to stay connected. And we do need to stay connected, and we need to use technology to make sure we're reaching out to our seniors. So I'll give a little call to action to our listeners. Today, call a senior and check in. Don't let another day go by without making a call to your neighbor, to a loved one, to a family member, to a friend, to somebody in the community. Call a senior and check in. That's what we need to do as a community.
And I'll piggyback on that. If you're making a casserole, you're making dinner, and you have a neighbor or a friend that you know is living alone, make two. Don't ask. Knock on their door and say, "Hey, you know what? I'm leaving you dinner for tonight." Because so many of them are so proud, they don't want to ask for help. They don't want to put you out, but we need to be there for them. And many other countries and many other communities come together and they coalesce around this. This is our time. This is our time to show the strength of humanity, the strength of Arizonans, and really, really supporting our older adult population. Really, truly
You're
is.
right.
You're
right.
I know.
This is our time.
I know you've been on the show before, so it goes really fast. So I have written down, with some help from a friend, some really good questions for you. So when we come back in the second half, I want to really dig deep, and they're healthcare questions, and they're relating to older adults, and stuff that you have done previously, and some things that you have shared with me that you're very passionate about moving forward. But I will say this, I have worked with our director for Access, Jamie Snyder. It's amazing what our leaders are doing through all of this. They are really coming together. While we've never planned for anything like this, I do like the fact that we are starting to think outside the box, figuring out how do we protect one of the most vulnerable populations during this pandemic and going forward, because we've had some issues relative to some of the things we're going to talk about, like workforce and access to other resources. So we're 2 down. We got 2 more to go. You've been listening to Health Futures, Taking Stock in You. I've got Senator Heather Carter in the studio. We got so much more to talk about. Stick around. We'll be right back.
Back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. And if you're just tuning in, we're in our second half here. I've got Senator Heather Carter. I would say she's in the studio, but she's coming at us via technology, Google Meet, and the phone line. And if you missed our first half, it was exceptional. Of course, whenever I have Senator Carter in the studio, we always have a lot to talk about. So go up to our website at cypresshomecare.com and click on the media button. Third button down is radio show. You'll catch that first half and many others that we've been bringing to you for the last 7.5 years. So Senator Carter, it's good to have you back. And we talked about a lot of different things in the first half, and certainly we talked about voting and how you can get your votes out there. And I encourage our listeners, if they missed that first half, to go listen to it on our website, but also I encourage them to go to maricopa.vote, and you can get a lot of that information from there. We also, we've talked about this pandemic and what it's done to us. We talked about social isolation and what it's doing to our senior population. And one of the things that, you've been amazingly supportive is for our home care movement and really delivering care in the home, whether it be direct care workers through Access, our state's Medicaid, or even private caregiving, and making sure that we had availability. So, one of the things I wanted to share with you is that no one will disagree with the observation that our population, our seniors, are aging at such a rapid rate that by 2030, we're going to have more people 65 and older than we are going to have 18 and younger. And that'll be a first in the entire country because we have such an aging demographic right here in our state. Yet the availability of direct care workers seems to be shrinking. And I shared with you the move that Cypress Home Care made last year to partner with a workforce company called Honor. Matter of fact, I had the CEO and president on the show just last Friday, and we talked about this great work that they do in recruiting and retaining and training this workforce. So, because we are short, and now we're in the middle of this pandemic, and long-term care facilities have been hit really, really hard, this workforce shortage is worse now than it was before. And I really would love to have your thoughts on how we can take care and protect our vulnerable population during this pandemic and certainly beyond. And and I know that this is near and dear to your heart. So I would love for you to share with our listeners, what do you think? How can we care for our old elderly, and how do we get more people into this workforce?
Well, first, I want to say a heartfelt thank you to everyone who's working to care for our seniors during this pandemic. This is difficult times. I know you are concerned for your own safety and healthy for your own families, and you have stepped up to the plate and done what we've needed to do as a community to make sure that our seniors receive the care that they deserve and that they desperately need. So thank you to everyone working in the direct care industry, because it's not easy work. So what do we need to do? Well, two things. I serve as the Higher Education and Workforce Development Chairperson in the Senate. To start, we were facing a workforce shortage prior to the pandemic. The pandemic has only made it worse. So everything that we have put forth over the last decade is even more important to continue to work on now. Everything from making sure that our workforce has the proper training to care for our loved ones, making sure that they have a career path that allows them to progress in their own personal career. We want to make sure we have competitive entry-level wages so that we can attract and retain the top quality care that our seniors deserve. And now, even more important than ever, is making sure they have the tools they need to be successful. And what that amounts to today is masks. They need PPE. They need any sort of supplies that they may use to care for our loved ones. So, for example, when they go into somebody's home and they're taking care of a senior, they need a mask. They may need gloves. They may need scrubs, depending on what type of care they're providing. And then when they go to the next senior home, they will need new equipment. And what we're finding today immediately is that we don't have enough personal protective equipment for our caregivers. And that is just a shame. And we need to do whatever we can as a state to come together and collect these resources to care for our loved ones. And obviously the direct care workforce are not the only people that need PPE. We need it in our hospitals. We need it in our rural communities. We've heard about terrible, terrible outbreaks on some of our tribal nations. So like up in the Navajo land, I mean, think about what they're going through. I think as a state, under the governor's leadership in partnership with the Department of Health Services, we've done an excellent job of sending out the call to collect the PPE. Now we need to continue to do that work and get it deployed in as fast fashion as we possibly can, because our caregivers need that immediately. So it really is twofold. We've got long-term policies and procedures that we need to continue to work on, like making sure that the wages are competitive to attract and retain high-quality care, making sure that they have the proper training to provide the care to our loved ones. And then immediately, we need to make sure they have the equipment to do so successfully to keep them safe and keep our seniors safe.
You hit so many very important points there, and certainly, the adequate supply of PPE is so important, and the training's important. I mean, donning and doffing PPE is so critical because you can wear it, and if you don't know how to take it off properly, and you're wearing a gown and you just go ahead and take your mask off and then you pull the gown up over your head, you've just infected that direct care worker. So important for us to have the proper training. And so many of my colleagues in the home care space have invested a lot of time and money in this and making sure that we have direct care workers that are adequately equipped and trained and protected to care for one of the most vulnerable populations. I can tell you at Cypress, every one of our caregivers goes in there and they have PPE right now. And we are offering PPE for our clients to wear as well. We're encouraging it. We can't make them, but we know that masks, I wear a mask to protect you, you wear a mask to protect me. And it's so important for us to protect this vulnerable population. And you hit about the workforce, and we knew there was a shortage. The Paraprofessional Healthcare Institute, they're out of New York City, been around for about 38 years. They were predicting in the state of Arizona between now and 2026, we were going to have 100,000 caregivers that we were going to be short. 100,000. So, one of the things that, you hit on the nail on the head was about wages. And I'm hoping that through all of this, that we can finally deliver meaningful wages to this workforce. Because we've heard a lot about teachers, and I know that's passionate. You're passionate about that because that's where you came from. And we've done a lot to help teachers, but this workforce we have not. And hopefully through all of this, they'll be recognized as these unsung heroes. So I'm glad you brought that up. One other piece I want to bring up too is you talked about the direct care workers. I want to give a big shout out to those family caregivers. Those family caregivers like you, Senator Heather Carter, that are making that ultimate risk, who are taking that time to care for their loved ones, as well as keeping their own households up and their own careers up, because they are really the unsung heroes in our communities. You've been listening to Health Futures, Taking Stock in You. We're down 3 segments. We got one more left. Stick around. We'll be right back. I've got Senator Heather Carter coming to you right through technology and telephone. We'll be right back. Hi, my name is Bob Roth, and I am the host of Health Futures. We are live every Friday at noon and have been for the last 7 years. In addition, I am the managing partner for Cypress Home Care Solutions. We are a home care agency that has been supporting our community for the past 26 years. This pandemic has been extremely challenging for families, and certainly on the options on what they can do with their older adult loved ones. With the communal living space being so challenged through this pandemic, home care is a great option and is typically preferred 9 times out of 10 by our older adult population. So if you're wanting to keep your loved ones at home where they can be safe, please call us at Cypress Home Care Solutions. You can reach us at 602-264-8009 or look us up on the web at cypresshomecare.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. We're on our 4th segment, so we got a lot to cover. I got Senator Heather Carter on the air with us, and it is an election year. She's encouraged you to go out to maricopa.vote to learn more how to get your ballot in, and I'm going to give her a shameless plug. You can donate to her campaign and learn more about how to vote by going to her website, voteheathercarter.com. I do want to mention that she is supported by the Greater Phoenix Chamber PAC, as well as the police and firefighters unions, and lastly, she has been endorsed by former Governor Jan Brewer. So welcome back to the show, and we've got a lot to cover. We covered in that Last segment, we talked about workforce and workforce challenges. We talked about how direct care workers are really our heroes in our community, and our unsung heroes are their family caregivers that are making the ultimate sacrifice to care for their loved ones. I want to talk about something that you did initially in 2017. So here's my question to you, Senator Carter. During the 2017 legislative session, you introduced legislation that would require hospitals to offer flu shots to anyone over the age of 65 prior to being discharged. The patient didn't have to actually get the vaccination, but they at least had to be offered the convenience of getting it right there and then. The bill didn't get a hearing in the Senate. Fast forward now to 2020, we know that there is a likelihood for a second wave for COVID-19 coming, and we're still getting through this first one about the same time as an annual influenza season. Looking back 3 years later, after you introduced that original bill, what are your thoughts on how the legislature may have missed opportunities, such as increasing the convenience of getting a flu shot, to improve public health during a pandemic?
Well, you hit the nail on the head. We need to do everything we can to provide quality health care to not only our seniors, but to everyone in Arizona. And a piece of that is when our seniors present at the hospital and they perhaps are there for an elective surgery or an emergency surgery, it is a perfect opportunity to have a conversation with them to say, hey, have you had your flu shot yet? And they can say yes or no. We weren't forcing anything on our seniors, but this is a great opportunity to allow them to make that choice to say, you know what, I want to take that extra step and keep myself safe during the flu season. Fast forward to today, we are facing probably one of the most challenging public health crises any one of us has ever seen. And guess what? The flu isn't going away.
It's not.
So this fall, it's not going away. So this fall, we need to be breaking down the barriers for our most vulnerable, our seniors, our developmentally disabled, anybody who wants to get a flu shot to be able to get a flu shot, because the last thing you need is both COVID-19 and the flu. And modern medicine is wonderful. We have eradicated diseases over the past century with vaccines. We know they work. So taking the flu as an example, we have tools in our toolbox to make sure we are protecting ourselves as much as we possibly can against the flu. And so we missed a real opportunity to have that offered. The good news is the hospitals are stepping up to the plate, and they're doing it anyways. So, this is why I'm endorsed by doctors, by nurses, by the hospitals, because we need to work together as a community to use modern medicine to keep us safe and healthy, not put up arbitrary roadblocks to keep us away from the care we need.
The thought of having COVID and the flu at the same time. OMG. OMG.
Right?
I mean, and
add to that pneumonia, because you could receive a pneumonia shot. I mean, we have modern medicine. We have the vaccine available to keep people safe. And I think it is important for us to provide those at a way that is easily accessible to the people who need it the most. So our seniors, while they are physically distancing, see, teachable moment, I'm using your language.
Thank
I
you.
love that.
Thank you.
I'm going to start saying that. While our seniors are physically distancing, if they, for any reason, have to go to the hospital, don't make them come out 2 and 3 and 4 times to receive their flu shot for the fall. Thank you to our hospitals for stepping up to the plate. Thank you to our doctors and our nurses for offering it to them. I really would have liked to see that scale up across the state.
So my last question to you. For the last 2 legislative sessions, you have been at the forefront of 2 major legislative battles. In 2019, you were at the tip of the spear protecting the legal rights of victims of sexual abuse. And this year, your focus was on protecting the health and safety of firefighters and their increased likelihood of becoming stricken with cancer due to the nature of their work. For many legislators, having one legacy bill is an uphill climb in an entire legislative career. What was your motivation to take on 2 such difficult issues in such a short time frame?
I serve the people of Arizona and my legislative district 15, and it is an honor. The least I can do is stand up for them when they need it the most. We are talking about two different populations who need help and support. This is common sense. It shows that we care about people, and we just need to do the right thing. These are simple issues. And guess what? Politics being what they are, people decided to take a political path instead of just doing the right thing for public policy to help protect two very, very, very vulnerable populations. I mean, you identified them. If you're an adult and you suffered from a sexual assault as a child, that predator could still exist in the system where your abuse took place. The bill that we finally got over the finish line will help root out these predators from institutions across our state and hopefully protect anybody else from falling victim. And that's the right thing to do. I'm so grateful we were able to get that over the finish line last year. This year, we had unfinished business. I was standing up for our firefighters. We put in place a bill 3 years ago to ensure that our firefighters who fall victim of cancer, and it wasn't all cancers, it was cancers that science, research had demonstrated were more statistically significantly likely to happen because you are a firefighter fighting in dangerous situations, running into burning buildings. And we thought we had the language right when we passed it in 2017, that you would assume they contracted that cancer in the course of their work and that they would be able to receive workmen's compensation benefits. Well, guess what? Big government, being what big government is, put up roadblocks, and our firefighters, rather than fighting cancer, had to fight the government to receive the benefits that they rightly deserve. That is not okay. So we ran a bill this year to fix it, to say, guess what? If you're not going to presume it, we are just going to say it is obviously contracted in the line of duty, and therefore you will receive workmen's compensation benefits if you have these particular cancers that science and research shows that you are more likely to receive in the line of duty. And, you know, I will add this to the conversation very quickly because I know we're here at the end. Our frontline workers, specifically our firefighters, are falling victim to COVID at a rate that is just unacceptable. So right before we ended session, I tried to say, we need to give them the COVID workmen's compensation protections that they deserve. That was also denied by the House. So this is unfinished business. It is near and dear to my heart and to my constituents, and I commit to continuing to do the important work for not only these issues, but all of the issues where we have unfinished business for the people of Arizona.
Well, let's get you back in. And as I said before, shameless plug on my part, not yours, go to voteheathercarter.com. She's got a lot of unfinished business. You can tell and you can hear the passion from her voice. I am excited to support you. I'll give you the final send-off. What lasting message? You got about 5 seconds to leave with our listeners.
Arizona, let's be safe, stay healthy, and mask up. And we're going to come out on the other side stronger than ever.
Make it a great day. Have a great weekend.
No place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.
I finally had to take the car keys away from Dad this week.
I don't think Mom's been taking her medication, and I'm concerned.
I can't juggle work, my kids, and go look after my parents. It's just too much. Do you need help taking care of a loved one? Cypress Home Care is here for them and you. Bathing, meal prep, monitoring, errands, and more. Call Cypress Home Care 602-264-8009 or go to cypresshomecare.com. Cypress Home Care. Help is here.